This video demonstrates a useful approach to performing a combined posterolateral corner reconstruction and lateral IT band extra-articular tenodesis and the setting of an anterior cruciate ligament reconstruction. The patient is prepped and draped in the supine position and an exam under anesthesia is performed. After completion of the ACL graft harvest and diagnostic arthroscopy, we begin our lateral approach centered on the lateral femoral epicondyle. A careful dissection is then performed to identify, mobilize, and protect the common peroneal nerve. This dissection is continued anteriorly to perform a complete nerve neurolysis. The fibular head is then identified and exposed both anteriorly and posteriorly with a retractor placed posteriorly. The tibialis allograft is measured and a corresponding fibular tunnel is then drilled from anterolateral to posterior medial. A shuttle suture is then placed to facilitate graft passage. Attention is then turned to the iliotibial band where two parallel longitudinal splits are created approximately 8 to 10 millimeters apart in width. This split is carried distally to expose the lateral femoral epicondyle and popliteal sulcus. A high-strength loop suture is then used to perform a locking whip stitch of the IT band autograft. The anterior popliteal sulcus is then exposed, pinned, and sequentially reamed to create our popliteal socket. Shuttle sutures are then passed in the popliteal socket and deep to the IT band. The prepped tibialis allograft is obtained from the back table and is subsequently docked in the popliteal socket using an adjustable cortical fixation button. The button is tensioned on the medial cortex and the graft is seated in the socket. Utilizing previously shuttled sutures, the anterior or distal limb of the graft is then passed deep to the IT band. The allograft is then shuttled across the fibular head from the posterior to anterior direction. The allograft is then passed again proximally towards the femur deep to the IT band. A shuttle suture is used to pass the LAT graft underneath the remnant FCL and surrounding tissues. The lateral femoral epicondyle is identified and a guide pin is placed just proximal and posterior. Isometry of the FCL graft is assessed. Both the FCL and LAT grafts are then sized with a corresponding socket being drilled over our guide pin. The LAT and FCL grafts are then measured and trimmed to remove the excess graft not needed in the socket. Both the LAT and FCL grafts are whip stitched together with multiple passes. However, only the FCL sutures will be affixed to the cortical button. The grafts are then resized to ensure they will fit in the drilled socket. The shuttle sutures are then passed across the femur, followed by docking of both the FCL and LAT graft. The grafts are then tensioned across the adjustable cortical fixation button. Retensioning of the popliteus and FCL limbs are performed sequentially. And after tibial fixation of the ACL reconstruction, backup interference screw fixation of both the popliteus and FCL limbs are performed sequentially. Finally, an exam under anesthesia is performed, assessing both translational and rotational stability of the knee. Thank you for your time.